when people estimate how short we are in numbers of healthcare staff, we're running into tens of thousands, hundreds of thousands of staff. And this isn't a problem that's just occurred as a result of the pandemic. It's been an ongoing issue that stretches back over a decade or so. And a lot of it is to do with the retention crisis. It's not just training up more people, but more and more people are leaving the professions, the healthcare professions, and that's very worrying.
Jeremy Hunt told us last week that 150 deaths happen every week in the NHS, which could have been avoided. I mean, this isn't just an NHS problem. It's something that happens in private hospitals too and around the world. But what can be done to try and improve the situation in the National Health Service? Let's now speak to two people who know the health service well. Professor Dame Anne-Marie Rafferty is Professor of Nursing Policy at King's College London, a former president of the Royal College of Nursing, and has been, in 2009, was appointed to the Prime Minister's Commission on the Future of Nursing and Midwifery. Good morning, Dame Anne-Marie.
Good morning, Matt.
It's great to have you with us. We've also got Dr. Kamran Abbasi, the Editor-in-Chief of the British Medical Journal. Morning.
Morning, Matt.
Morning. Nice to have you with us. Anne-Marie, one of the things that I came across, I was just thinking a lot, reading both Jeremy Hunt's book and speaking to him, and then, having looked into it more, is the NHS just too big? It's such not that I'm suggesting it should be broken up, but it is such an enormous organisation with doing so much and so many different things that mistakes will happen. Or is that a sort of defeatist attitude? And do you think we need to be doing more?
Well, I agree, Matt. It is a highly complex organisation with many moving parts, as you've just indicated. And I think there are changes afoot again in terms of the overall governance structures and realignment of some of the top bodies, decision-making bodies within the NHS that might facilitate more joined up decision-making and planning. And one of the things that we definitely need for the future, and Jeremy Hunt has been a champion of this, is a long-term plan for the workforce. And very, very sadly, that was a clause, an amendment that was not supported within the recent Health and Care Bill. And that is actually quite shocking. So even when you want to do the right thing, it doesn't necessarily mean that you can do the right thing. And just on the point that we were discussing before around patient safety, we've done research that demonstrates that nursing numbers are linked and associated and can predict patient safety in terms of patient mortality. So one of my fixes for the NHS, of course, you would expect me to say this, wouldn't you? But actually it's backed up by the evidence, is that we need to invest massively in nursing numbers. Because if we don't have nurses, which, they form the largest safety critical profession in the world, actually, 28 million of us, I think that's probably more than pilots or nuclear workers. It's the largest and most, I would say, potent insurance policy that the NHS and social care has between them. That's over 3 million workers in the country, actually make a huge contribution to preventing patient harm.
I suppose that's a key point, isn't it? And Cameron, is that as Jeremy Hunt was saying, it does come in part with increasing numbers because you have more staff, more doctors on wards. They have more time to stop and think and talk to each other, and then to pause and learn lessons. Whereas if you're run ragged going from one crisis to the next, you're very tired, you're more likely to make mistakes, you're more likely to sort of try to move on and do the next thing. It actually does come down to numbers to a large extent.
Yeah, Matt, thank you. Yes, it does come down to numbers. The first thing, we can talk about those in a second. One thing to say, though, about Jeremy Hunt is it's great that he's championing all these issues now, but as most healthcare professionals will tell you, and I'm sure many patients will, he failed to make progress on almost all of these things while he was the longest serving health secretary. So we all have to take it with a bit of a pinch of salt, but certainly the workforce strategy is a is a very important part of the solution here. And if you look at the bare numbers, we have something like 2.8, 2.9 doctors per head of per 1,000 people in the UK, whereas the comparable figures from Germany are about 4 doctors per 1,000 people, and across the EU it's about 3.7. So we're well short. And when people estimate how short we are in numbers of healthcare staff, we're running into tens of thousands, hundreds of thousands of staff. And this isn't a problem that's just occurred as a result of the pandemic. It's been an ongoing issue that stretches back over a decade or so. And a lot of it is to do with the retention crisis. It's not just training up more people, but more and more people are leaving the professions, the healthcare professions, and that's very worrying. So retention, if we could address retention, keep people in the health professions working in the NHS, then that would go a long way to start to mitigate against the challenges that we're facing.
And actually, that was one thing that I discussed with Jeremy Hunt, because at one point I think he promised 5,000 more GPs. And he did add some, but then so many others left that he ended up with about, was it 300 extra?
I mean, the problem is he upset people. I mean, because he brought in a lot of the changes around that upset continuity of care, shift working. He upset junior doctors, so people left the profession. But yeah, he brought in 5,000, lots more left. People are leaving on a weekly basis. We know the stats. But what's needed is that the government needs to come up with a very clear workforce plan with numbers, a clear strategy that can be implemented with targets and with some funding to make it happen. And it's kind of been hitting everybody in the face for over a decade. Yet there's a certain reluctance to do anything about it, except to pay lip service to it.
Marie, I discussed this with Jeremy Hunt about there seems to be an intrinsic problem particularly with healthcare. It takes 8 years to train a doctor. That's potentially at least 2 general elections. And part of the reluctance, it strikes to me, as to why politicians won't say, right, we're going to train 10,000 more doctors, is because someone else is going to get the credit for that, which is a very short-termist political response rather than one that reflects healthcare. Do you think that we need to sort of... it's always a slightly depressing thing when you think you've got to take these decisions away from politicians. But in the same way that, interest rates are set now by the Bank of England rather than the Chancellor with an eye on a general election, whatever it might be, do we need to sort of have a more independent NHS, which does some of this planning in terms of the numbers of doctors based on population and medical developments rather than short-termist electoral considerations?
Well, that's interesting because it's a point that was actually made as a recommendation from a report that I was involved in co-leading from students at King's College London across all faculties. And they drew that analogy, Matt, with the Bank of England, that we should have an independent NHS board, which should oversee the governance. And that was really a response to the critique that the NHS is forever a political football, and the behaviour politically is exactly as you've just laid out. But I think just one point I'd like to make to the public and listeners is that in contradistinction to the airline industry or the nuclear industry, I think that the public would be shocked to know that there's no legal framework in place for minimum staffing standards for nursing. We have legislation in Wales and in Scotland, and we're pushing on that in Northern Ireland. One of the great outcomes, of course, from Boris Johnson's review of the protocol, if it could facilitate that in Northern Ireland, would be brilliant. But England is a kind of behemoth that so far has been resisting that pressure for legislation. We need minimum standards of nurse staffing. We have them in other areas, in childcare, for example, even in looking after dogs in kennels. And we can't actually provide that for patients in hospitals. And I think until we set those standards and have those minimum standards and thresholds, then we're really on a slippery slope.
Just fun, I want to ask you both, have you read his book? Are you going to read his book? Do you think Jeremy Hunt's got anything useful to add to the conversation?
Yeah, I mean, Personally, I probably won't read his book, Matt, if I'm honest with you. I mean, I've read many interviews with Jeremy Hunt, and you did a very nice piece on it in the Times as well. And going back to your point about an more independent NHS, I think that's absolutely one potential and very good avenue to explore. And unfortunately, the current bill that's going through Parliament makes the NHS less independent. So that is a point of concern, and I'd support what you're saying. Can I just go back to a little bit the point about that you were talking to James and Martin about, which is the no blame culture in the NHS, and again a bit like some of the solutions that Jeremy's come up with. Because the other reason I won't read his book is because they're out. We've known about them way before he was the health secretary. So it's surprising that he's come to them so late. Is that there's something called a no-fault compensation scheme, which is used very successfully in New Zealand, for example, and that takes a lot of the heat and a lot of the blame out of healthcare and blaming staff and blaming doctors and blaming nurses, and that's one potential way, very concrete thing that can be done to help improve the situation, so we don't have to hear situations like James described of his experiences and Martin described his experience. And we want to avoid that, and to avoid that we have to get rid of blame, and no fault compensation is an established way of doing that.
It's really good to speak to you. Thanks so much for that. It's Dr. Cameron Abbasi, the editor-in-chief of the British Medical Journal, and Professor Dame Anne-Marie Rafferty. Oh, actually, Anne-Marie, I didn't ask you. You're going to read the book.
I am actually, because I'm interested in history. I'm a historian, and I think what Jeremy Hunt has done, he's actually been a champion for patient safety. Of course, the Chief Medical Officer, Liam Donaldson, was before him, but it's like reading a history of the patient safety movement. So from that point of view, and perhaps identifying missed opportunities, I'm sure that would resonate with James and Martin and many others. Yes, for the reflective learning that it might provide, and holding him to account as well.
I know, exactly. It's such a difficult thing, because on the one hand you think, well, you were health secretary for a long time, why did you do something about this? The book actually charts, sometimes he did, and sometimes he admits he could have done more. But, I think we should probably encourage politicians to be slightly more self-reflective rather than telling us everything that was marvellous. Really good to speak to you. Professor Dame Anne-Marie Rafferty, Professor of Nursing Pathology at King's College London, and Dr. Cameron Abbasi, the Editor-in-Chief of the British Medical Journal. Thanks very much for joining us.